All attendees are in listen-only mode.
Welcome. It's my extreme pleasure to serve as the moderator for today's Ask an MS Expert webinar. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee, where I work to ensure that the perspectives and priorities of families affected by progressive MS are represented in all of the projects and work undertaken by the Alliance. I'm a district activist leader for the National MS Society, and I also chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today. I see that people are still joining the webinar, so let's give them another few seconds and then we'll get started. This webinar is really all about getting answers to the questions that are on your mind. So before getting underway, I want to review how you can submit your questions. If you're connecting through GoToMeeting, you had two options to join the webinar, either by phone or using your personal computer. If you joined us using your personal computer's mic and speakers, you'll have the ability to submit questions and comments through the chat box that you should see on the right-hand side of your screen. If you happen to join by phone, then you're going to be in listen-only mode. Today's webinar is also being streamed live on Facebook and YouTube, so welcome to everyone with us on both of those platforms. If you have the ability, I encourage you to submit your questions and comments, as we have a team capturing those as well. As I chat with our experts today, you can submit your questions as they come to mind, and we're going to address as many of your questions as we can. Now, I know many of you might have some very specific questions about your own situation. Because of our limited time together, we're going to be focusing on the questions that pertain to everyone. And following the webinar, the Society's MS Navigator team will be standing by to address those specific questions that you might have. And I'll let you know how you can reach an MS Navigator before the end of today's program. Now, obviously, I can't make this webinar happen all by myself. There are lots of amazing people working behind the scenes. And one of them is Julie Field. Julie is going to help me today by pulling together your questions in the background while I'm busy talking. We may even get Julie to read some of those questions herself. I should also mention that due to the large number of participants we have today, everyone has been placed in listen-only mode. And if you're interested in reviewing today's discussion with our experts, this webinar is being recorded and it'll be available on the Society's website for your reference. Today's Ask an MS Expert webinar is one of a series of virtual opportunities the Society is committed to offering. So I hope you plan on joining us each week. And hearing your questions and listening to what's on your mind is going to help shape future Ask an MS Expert programs. So I hope you're ready to participate. Our objective today, and our objective in all of the Ask an MS Expert programs, is to connect with you, share important information that you can rely on, and provide a forum for you to connect with experts on the topics that are on your mind, the topics that really impact people affected by MS. When we read through your feedback on our previous Ask an MS Expert webinars, and we look at the questions that we're continuing to receive, well, it's clear that COVID-19 will be a hot topic in all of our lives for the foreseeable future. So we're going to continue providing the latest updates on the key questions that keep coming up, as well as the new information that's trending in the news this week. There's an awful lot of research to remind us that exercise delivers a variety of benefits to people living with MS. So today, we're going to be sharing some tips for exercising at home to stay healthy. And of course, we're going to spend time answering the questions that are on your mind. We'll also share some key resources that you can turn to anytime for credible, reliable information about COVID-19 and MS. Before we dive in, I'd like to acknowledge that these are new and rapidly evolving times, so we do have a disclaimer to review. COVID-19 is a new coronavirus, and there are currently no published data available about the virus and MS. The information and recommendations presented in this program are based upon the professional opinions of MS experts and the evidence currently available about MS, infections, and disease-modifying therapies. This is a rapidly evolving situation, and we'll update information as it becomes available. The information that is shared does not substitute for your healthcare provider recommendations. Please check with your healthcare provider before making any changes to your treatment plan. And be sure to check the Society's website at nationalmssociety.org/COVID-19 to keep up with the most updated information on MS and COVID-19. Now, let's meet our experts. Kathy Costello is the Associate Vice President of Healthcare Access for the National Multiple Sclerosis Society. Kathy leads the Society's strategic initiative on access to quality healthcare, which focuses on self-advocacy, professional workforce development, healthcare professional relationships, and wellness. Kathy was a nurse practitioner and adjunct assistant professor at the Johns Hopkins MS Center in Baltimore, Maryland, and she's written and lectured extensively on MS and MS care. Mandy Rohrig is a physical therapist and senior programs consultant for Can Do MS. She graduated with high distinction from Nebraska Wesleyan University with a Bachelor of Science in Exercise in 2003 and received her doctorate of physical therapy in 2006 from the University of Nebraska Medical Center. Mandy has been an active member of the American Physical Therapy Association since 2003 and a member of the Neurological Physical Therapy section of the association since 2007. Mandy specializes in the rehabilitation of individuals with neurological diseases, with a special emphasis on treatment of individuals with multiple sclerosis and Parkinson's disease. In addition to chronic neurological conditions, she's also received specialized training in the evaluation and treatment of individuals with balance and vestibular disorders. And Mandy serves on an advisory board for the National MS Society's Professional Resource Center. Well, Kathy, it's great having you back since you helped kick off our first two webinars. We're now on week 6, and we're committed to keeping everyone updated on the latest news about COVID-19 and MS. Last week, we covered food prep concerns, the use of face coverings, plasma, and of course, we addressed questions about MS medications. Let's talk about the news that you've been hearing this week, the things that people should be paying attention to or perhaps not worrying so much about. Earlier this week, I mentioned on my podcast that there were no FDA-approved at-home coronavirus test kits, but that's just changed. What can you tell us about that?
Well, thanks, John, and it's really a pleasure to be back and participating in this webinar. This has been a really exciting initiative for the MS Society, and hopefully the same for people living with MS. So you're right, there now is an at-home test that has been approved. It was approved actually just on Tuesday, and the FDA did have a news release, and all the major news outlets have reported on it as well. This testing kit is called Pixel, and it's made by LabCorp. And it's not available to everyone at this point in time, but it will be available to most people at some point in the very near future. So it's an easy to use at-home test that does require a prescription from your healthcare provider. And it's a nasal swab, and there's a specialized swab within the kit that someone would use to actually get some of the cells from inside of the nose. And then there's another part of the kit where you put that swab into a mailer and send it off to LabCorp. And the results would be ready in 1 to 2 days. So the first users of this kit are going to be frontline healthcare workers and first responders, because we really do need to know who of them have been exposed and have potentially contracted the virus. But ultimately, it will be available again by prescription to the general public. It's a little different than the test that's used now, like the drive-through test. They require a pretty deep swab of the nasal passage, and it can be a little bit uncomfortable. This one will be far less uncomfortable, as it just needs a swab from the anterior nasal cavity. So again, this is not ready for prime time just yet, but it is coming very, very soon, and ultimately will be available for everyone who has a prescription to have this test done.
Well, that's really good news. You know, lately we've also seen the launch of COVID-19 MS registries. Can you explain what these registries are all about?
Sure. This is really very, very important work that's going on. There are registries for people who are living with MS to enter information, and there are also registries where healthcare providers enter information. So let me separate them out a little bit. So in the United States, there's a very large registry. It's actually a survey by iConquer MS. iConquer MS is an online portal under the organization, the Accelerated Cure Project. And iConquer MS is part of a national research network called the CoreNet. And it actually enables people living with a particular disease, in this case, MS, to collaborate on research efforts. And it becomes critically important because who knows what's happening better than the people who are living with the disease. And so that's also very true when it comes to COVID-19. And this survey, which will collect data, is really intended to understand what the experience is like for people who are going through this pandemic. Not just those who actually get the infection, but for anyone who may be experiencing something, feeling something about it, going through this very, very difficult and uncertain time. So this launched just a couple of weeks ago, and people can access it on the iConquer MS website, which is iconquerms.org. You do need to register, and then you can take the survey, and then those data will be collected. There's another registry, another database, and this is one where the healthcare provider enters information. And this is called the North American MS COVID-19 database. This is a data collection effort that was a collaboration between the National MS Society and the Consortium of MS Centers. And we put together a group of really smart people, epidemiologists and neurologists and statisticians, to see what do we need to know? What would help the community most? And so a database of survey questions was put together, and it was able to be designated by the review boards as non-human subjects research, meaning when someone's data is entered into this database, it's de-identified. Nobody knows whose data it is. It gets a number, but it's not identified in any other way. And that's important for a lot of people to know, that if someone's entering data about them, that it's not identified. And so what we're trying to learn from this is what are the factors, if any, for people with MS and some related disorders that impact either getting this infection or the course and outcome of the infection. For instance, do disease-modifying therapies impact getting the infection or the course? We actually don't know that for 100% certainty. And our guidance so far is really based on some assumptions. This type of data collection will give us that information. Now, people will say, well, when am I going to know? That's important. And unfortunately, it's not the kind of information that you can release one day at a time. And the reason for that is you need a certain number of cases in order to make anything of the data. For instance, if the first 10 people who are entered are all on the same medication, does that mean that medication's a problem? Hard to say, because the next 10 may be on something else. So you need to have a certain number on all of the different disease-modifying therapies to be able to provide some comparison and to make some understanding if that factor is important in getting the infection or the course of infection. And then there are worldwide efforts going on. So these types of provider-driven databases are actually happening in multiple countries around the world. And the good news is that much of the data can be harmonized between these databases, meaning that the numbers of people who are entered into the database rises very quickly. So with a worldwide effort, you may actually be able to get to some answers sooner rather than later.
Well, that's important information, and I know it's going to be helpful to researchers for years to come. And I'm glad you mentioned disease-modifying therapies, because I know that's something that remains a subject on the minds of a lot of our viewers today. What can you tell us about any updated guidance on the use of disease-modifying therapies during the pandemic?
Well, thanks, John. That really is an important question, and you're absolutely right. It's a question that we hear every day. And some of that is because there's a lot of confusion out there. There's been lots of advice. Everybody is doing that with the best of intentions. But when you get 4 and 5 and 10 different organizations or individuals, each of whom has their own credibility, but when you get different kinds of guidance that's out there, it becomes very confusing. What advice are you supposed to follow? So the National MS Society's National Medical Advisory Committee issued advice and guidance about a month ago, which, you know, in the world of COVID does seem like a lifetime ago. And so the group is revisiting that guidance to see if it needs to be updated. And there isn't any evidence at this point. There aren't any hard data that tell us anything. There's nothing that says this medication's a problem, but this one's not. That doesn't exist. So we'd still be making some assumptions and basing the guidance on what we know about MS, about the disease-modifying therapies, about viral infections in general, and any association with the disease-modifying therapies and any infection. But we don't know anything specific about these medications and COVID, and that's where those registries will come into play. So for now, we're just looking to see, is there an opportunity here to provide clearer advice? Can we clear up some of the confusion that's out there and provide something that makes sense? And so that not only people with MS, but their healthcare providers have some guidance to use in order to make decisions that really need to be highly individualized. Each person's MS is completely different, as is their response to medication. And so looking at these situations individually is really paramount. This hopes to provide some guidance in making those individualized decisions.
Kathy, some states have announced that they'll be reopening for business in the coming days and weeks. What does that mean for people living with MS?
Yeah, so we're all hearing this, and there's obviously no one wants to keep the economy under wraps forever. No one wants to keep businesses closed forever. It's important to our economy. It's important to each of us as individuals, but there needs to be a significant amount of caution and procedure when reopening businesses or an economy. And in most of these situations, the governors of states are issuing procedures that will gradually open up businesses. Having said that, it is really important for people to still follow very good infection control procedures. What do I mean by that? Certainly that hand washing becomes extra important. Wiping down surfaces, still important. Social distance, definitely still important. Keeping 6 to 10 feet away from people, not gathering in large groups, and wearing a facial covering. Not the kind of masks that healthcare workers wear, but even a homemade mask. And you know, these have been advertised on TV, and you can see how they're made on the CDC website. But these homemade cloth masks can be very helpful in helping to reduce the transmission of this virus. So people really need, despite that there will be opening up or partial opening of businesses, people really still need to be very careful. I tell you, in my state, we opened up the beaches last weekend. And I have to tell you, people lost their minds. People ran out onto the beach. They had complete disregard for social distancing. No one was wearing a mask. It was as if they believed that opening up the business meant that the pandemic was over. Please understand, this is not true. And it is very important to still follow these really important practices in your life, even as we emerge from some of the stay-at-home measures that we've been under.
as we're going through this new normal, it occurs to me how in many cases, we have to be our own best friend. I read about businesses that are opening this weekend in some states that offer, well, like nail salons and tattoo parlors. And I heard on the news the owner of a nail salon saying, well, we're going to require that everyone wear a mask. But we also know that if you're having your nails done, you can't be maintaining social distance at the same time. And we have to be the ones to keep everything you just said in mind to really make sure we're taking the appropriate precautions to help ourselves now, don't we?
Absolutely. I can't say on a personal level that I'm in agreement with all of these things, but I'm not the decision maker. What I do recommend is that people truly be cognizant and follow social distancing, hand washing, wearing a mask. Having your nails done does not maintain social distance. And while it's nice, is it necessary? And think to yourself, are these things necessary? Must I do them? Or would it be better if I maybe hold off on that and follow these very safe practices? These are choices that we have to make, but I'm hopeful that we've provided some information to make an informed choice on what type of actions people take.
And thank you for that. Mandy, we're really excited to have you with us today. Last week, we answered questions about diet and exercise. And as people are finding their new normal, mostly at home, keeping physically active is essential to staying healthy. In addition to questions about diet, we've received lots of requests for more information about staying physically active while you're at home. We heard from Julio, who wants to learn more about staying active as part of a weight loss strategy. Emily is looking for tips on staying active during the quarantine in general. And Janet also wants tips for physical and mental exercises. Mandy, can you tell us why people who might not be active right now should consider incorporating regular exercise in their day-to-day lifestyle?
Thanks, John, and thank you everyone for joining. Yes, it's difficult right now. It's difficult for everyone to try to figure out a way to exercise in these difficult times. But as you all know, even in the presence of COVID, MS symptoms continue to persist and can continue to create challenges in your lives. So it's important to recognize the benefits of exercise. We know that exercise can be helpful with symptom management. It can help with improving your balance, improving your walking, improving strength. It can also help with mood, especially when we're all feeling a little down and uncomfortable during this COVID period. It can potentially help with that. It can help with cognitive challenges. So exercise has a whole lot of benefits that can help with day-to-day challenges, even while we're stuck in our homes. Furthermore, it's important to note that exercise can influence vascular comorbid health conditions. And why this is important is because comorbid health conditions, specifically those vascular ones such as high blood pressure or high cholesterol, have been suggested to increase disease progression. And one of the strategies that we can do to influence those comorbid health conditions is to exercise. So it's a really great benefit, not just for symptoms, but for our overall health and potentially disease progression. While I do think, and I do believe firmly in exercise, I think it's important to also note that physical activity is critically important. And the difference between physical activity and exercises is actually important to note, given the fact that a lot of us are out of our normal routine. So physical activity are those activities that we do every day. It's cooking, it's cleaning, it's dressing, it's preparing meals, it's driving, it's doing your laundry. It's all of the day-to-day tasks that we do in addition to exercise. So exercise falls under that physical activity umbrella. Whereas exercise is more specific and more structured. It has generally an intended purpose like fitness or improved functional gains. So both physical activity and exercise can be beneficial for our overall health. And I want to comment too that this is hot off the press, so I'm glad you all are hearing that a paper was recently published and released today that was led by the National MS Society that provides recommendations for exercise and physical activity for people living with MS of all ability levels. So our listeners right now can access the abstract through the MS Journal. However, it shouldn't be long and you should be able to access the entire paper. But one of the key recommendations of that paper is that all people living with MS, regardless of ability levels, should try to engage in 150 minutes of exercise per week or 150 minutes of physical activity per week, or both if you can do both. So that is the goal and that is the recommendation.
When it comes to exercise, sometimes just getting started is the biggest challenge. What are some of the ways that people can motivate themselves to get started?
Isn't that the truth though, right? It's very difficult to get motivated with exercise, especially given these very unstructured, uncertain times. If you're someone who was accustomed to going to the gym to do your exercise, that likely isn't an option for you right now. If you are someone who liked to go outside and exercise or exercise with a partner, again, that's not those typical things that we like to do for our physical activity and our exercise may not be the case right now. So it's important when we're thinking about becoming motivated and rethinking our motivation to maybe substitute a little structure and routine to help encourage that motivation. So maybe delegating exercise time. So you can tell your family 9 o'clock every day is when I'm going to be exercising. And you can contact a partner and have them join you maybe via FaceTime or video conferencing of sorts. Some folks too also find it easier during the circumstance to sprinkle their exercise through the day, rather than delegating a full 30 minutes or an hour, for example, to do your exercise. Perhaps you work a little bit and do 10 minutes of exercise, work a little bit, do another 10 minutes. And that's perfectly fine and very achievable also. You can schedule classes. There's lots of online exercise classes and online exercise opportunities now that the pandemic has struck. So explore those and venture out and try something new. Step count competitions is another thing that I like to encourage my patients to do. What this would entail is saying, hey, John, I got 6,000 steps today. How many did you get today? And you try to invoke a little bit of competition in order to encourage motivation with one another.
Yes, I would have 6,001 steps in that case.
Then I'm going to have to step in place here while we're talking, right? Another good option too is sleep in your exercise clothes. I know it sounds a little silly, but sometimes if you're wearing the clothes that you're going to exercise in, your mind's already started to transition to that next intended project, which is exercise. But again, remember, physical activity counts. I've got 3 kiddos, and running around after those little ones some days is a lot of exercise. It's a lot of physical activity. Doing the laundry, folding clothes. If you put folding a mountain of clothes can feel like a good workout to your arms. If you want a little more resistance, you can always put some cuff weights on your arms and still get a good workout while you're doing something that needs to be done. So sometimes the key is just start doing something.
Mandy, I'm wondering if you can share some exercises that people can easily incorporate into their day-to-day routine while they're at home.
Sure. So in the world of exercise prescription, we like to kind of categorize exercises into aerobic exercises, strength training exercises, flexibility, and then balance activities. So all of those can be done with some adaptation within the home and based on someone's ability levels also. So for example, maybe for some exercises, for aerobic exercises, someone could walk around their home And that could be aerobic exercise for them. For our folks who use wheelchairs for mobility, it can be walking in place, moving the arms, getting the arms moving while you're seated in your chair. I actually had a patient who told me that she found out that it was 92 laps around her living room to get 1 mile. So find out those strategies to still kind of get a little bit of movement and a little bit of exercise. Some examples of some stretching exercises might be using some side neck stretches, some chest stretches. A lot of us are sitting more and perhaps a bit more sedentary, or on computers more than what we're accustomed to. So our back and our neck and our shoulders can get a little bit stiffer. Kind of a side trunk stretch can feel really good to stretch those muscles after we've been sitting for a prolonged period of time. This just gives you all a little taste, but the National MS Society on their YouTube channel has 3 really great videos demonstrating some examples of aerobic exercises, stretching exercises, and even a little bit of deep breathing activities that can be done. Again, those videos are wonderful because they do demonstrate how to complete those exercises at an assortment of ability levels. In addition to the society, another resource would be the MS Trust over in the UK has another great series of videos that can be done from home for all abilities as well.
Well, those are some excellent tips. Thanks for that. Once someone actually starts exercising, sometimes the next biggest challenge is to be consistent, to keep that routine going, right? We heard from Barbara, who wrote that it's important for me to exercise daily to remind my muscles about what they're supposed to be doing. I'm better in the morning, so that's when I exercise. And keeping as positive a mental attitude as possible helps me so much. So Mandy, how can people overcome the barriers to keeping up with a regular exercise routine? And why do you suppose some people have a harder time with that than others?
Yeah, this is a good question, John. You know, just like everything in MS, it's highly individualized, right? So the barriers that are unique to me with respect to consistent exercise might be different for other people. So I think what's important is to first identify what those barriers are, and then work with your healthcare team to try to develop some strategies to manage that. But let's just touch on a few kind of the more common barriers that I hear about, and that might be barriers in this present day environment that we are all living in. So MS symptoms, specifically fatigue, is probably one of the greatest barriers that people live with. It can be terribly unpredictable, terribly exhausting, and uncertain, and it can vary day to day, and for some people even hour to hour. So I think one of the ways to manage that would be to consider some energy management strategies. And occupational therapists, they're kind of the gurus for energy management. They can help you figure out ways to budget your energy and to organize your day, perhaps using some different tools and adaptations in order to help you optimize your energy. Sometimes cooling products are another way that can help with managing fatigue. With respect to exercise, sometimes resequencing or reprioritizing the exercise program can make a tremendous difference for people. I like to tell folks we don't want you wasting your valuable energy on exercises that aren't giving you some return on your investment. So often sitting down with a physical therapist or someone who really understands multiple sclerosis can help kind of tweak and reorganize the exercise program in such a way that it minimizes the negative impact of fatigue. And I think it's unrealistic to say every day you can just work through this and figure out strategies to manage it. Some days are just crummy. Some days fatigue is just terrible. And those are the days that I would encourage you to consider some of those deep breathing activities. So really working on that diaphragmatic breathing where we're expanding our belly and filling it with air and then slowly exhaling through our mouths, all of which can be learned on the National MS Society's YouTube videos. But that can be a really nice substitute for those terrible kind of crummy fatigue days. Another barrier I want to touch on is time. And life is busy, right, John? Like, we are all busy with our work obligations in addition to our family and home obligations. So none of us are going to get more than 24 hours in a day, unfortunately. So we have to really make it a priority. And as we spoke early on in the webinar, of all of the benefits of exercise, exercise needs to be made a priority in your life, and it should be something that's communicated to those that you love. The last but certainly not least barrier I'm going to touch on is knowledge of exercise and knowledge of what to do. I think it's difficult for folks living with MS because often their body feels so unfamiliar. So how to learn to exercise and how to exercise in a body that feels unfamiliar can be tricky for some folks. So reaching out to your PT, reaching out to someone on your healthcare team to help you develop an exercise routine that works for you is really key. And one of the ways you can find a PT who understands multiple sclerosis is actually reaching out to the Society's MS navigators. And that number for all of you out there is 1-800-FIGHT-MS. You can call and speak with one of the navigators and they can help you find a PT to guide you.
Well, thanks for sharing some of your insights and some really excellent tips for exercising at home and doing it consistently. Now I'd like to focus our time on answering questions that have come in while we've been talking. Several people want to learn more about pacing themselves, knowing when to say when. We heard from Julia, who experiences tingling all over when she does high intensity cardio, so she switched to doing swimming and yoga instead. Garrett mentioned that he gets sick every time he does strenuous activity and needs to find ways to pace himself and understand his limits. Jan says her legs will be painful and even go numb when she exercises, and she's not sure if that means she's overdoing it. So, Mandy, what should people know about pacing themselves and knowing how much is too much?
John, these are really great questions, and I appreciate folks for being so honest and candid in their feedback. I want to say first and foremost that exercise should not be painful. It should not exacerbate symptoms beyond baseline for a really prolonged period of time. Exercise and working out should not provoke symptoms for days at a time. I've had patients say in the past, we exercised on Monday, but I still felt symptoms and felt pretty terrible up until Thursday. If that's a long time. I call that exercise hangover, actually. We want to discourage exercise hangover. So I like to encourage people to think about something called the 2-hour rule. And the 2-hour rule is that if you don't feel as good 2 hours after exercise, then you did too much. So in other words, if your symptoms don't return to their baseline intensity, then you may have done too much. So backing off, changing and altering the intensity or the duration that you're exercising, and maybe consider intermittently sprinkling them through the day instead may help to manage that. And while you're in the moment with respect to pacing, you can also think about something called a rating of perceived exertion scale, which is a 0 to 10 scale that corresponds to how you feel while you're exercising. So while we're just sitting and watching TV or reading a book, that's a very low level exertion. That's probably a 0. And as we start to exercise and move, that would be about a 3 to 5 out of 10 on that 0 to 10 scale. It's just a way for you to correlate how you're feeling with the amount of exertion that you had. So in your mind, to allow yourself to pace more comfortably, try to stay within that 3 to 5 out of 10 exertional scale. And again, when you are able to access that paper that the Society just released, there are some great suggestions and guidelines for how to exercise and how to use that RPE scale as a guide.
We've received comments from people on social media that balance issues are a barrier for them when it comes to exercise. Are there any exercise solutions for those people dealing with balance issues?
Yeah, balance is tricky. Safety is the utmost priority when you are exercising. We don't want to exchange exercise for compromised safety or increased fall risk in any circumstance. So one of the key ways that exercise can, particularly if you have balance issues, can be managed a little bit more is by considering more mobility aids. So I actually have an example to illustrate this. I had a patient who he ambulated independently and was able to go through his days without an assistive device. However, when he would try to walk for exercise, he was able to walk about a quarter of a mile unassisted. Getting a little discouraged by that because he was feeling like he didn't get that aerobic workout that he was hopeful to have. So we introduced a four-wheeled walker. The introduction of that four-wheeled walker allowed him to walk a mile, 1 mile versus a quarter of a mile. So not only was he safer, he was able to do more. So often when balance is an issue, being open to adaptations and how they may be able to allow you to do more exercise safely is a way to rethink that a little bit. We'd rather you do that versus less exercise and unsafely.
Let's talk about the challenge of dealing with fatigue. Pam wrote that the energy it takes to get out of bed is a struggle all by itself, let alone trying to figure out how to work out. And Tim says, fatigue kicks my butt. Sometimes I let it win. Other times I use caffeine to help boost my energy. Is there anything people can do to manage their fatigue and still have enough energy to exercise?
Yeah, we touched on fatigue a bit earlier, but it's tough. It's again very unpredictable. It can be a grizzly bear. But I think it's helpful when you're thinking about how to most effectively manage fatigue to start by talking about what the sources of fatigue are. So there's primary fatigue, which is the result of the disease process itself. And then there's secondary fatigue. Secondary fatigue is related to secondary issues. Say, for example, poor sleep because you're getting up in the middle of the night to go to the bathroom a lot because your bladder has troubles. Or maybe it's inadequate nutrition. You're not eating enough to fuel and provide you good energy. Maybe it's deconditioning. Maybe it's another health condition like anemia or sleep apnea, something that can impact your energy, completely unrelated to your MS. So I think first and foremost, if fatigue is overwhelmingly unmanageable, you need to talk with your healthcare team as you're able, so they can really investigate the contributing causes of your fatigue. Once that's kind of been sorted out, your next best group of healthcare providers are your physical therapist and your occupational therapist. And they can work with you on how to plan, how to prioritize, how to organize and position yourself in such ways that you're really optimizing your energy. So working with those healthcare providers are really key. But again, like I said, some days, as some of the listeners said, they're tough. They're really tough. So use those deep breathing exercises to still provide some benefit to your day, can also help reduce a bit of stress. And then if that feels good, then maybe try some stretches. And if that feels good, maybe you can do a little bit more. But give yourself a little grace. Sometimes fatigue is, as one of the listeners said, just kicks you in the butt. So.
No, it's no surprise that heat can be a challenge for people living with MS. Many folks on social media offered some great tips on how they overcome heat. Paige says that she puts a fan on the entire time that she works out, and she calls that life-changing. We heard from Paul, who said that when he feels overheated, he pauses, washes his face with cold water, turns on the AC, and takes a drink. Mary says when the heat's on, she has access to a pool, so she can still do low impact workouts in the cool water. And Tammy says that she wraps a cool towel around the back of her neck for a while. Are there any other tips that can help people with MS overcome the heat and avoid overheating?
Well, those folks provided some fabulous suggestions right there. Overheating can really exacerbate symptoms and cause a lot of challenge when people are trying to exercise. And if you feel terrible when you're exercising, you're not going to want to keep exercising, and you're not going to want to be consistent with it from day to day. So I think in addition to these suggestions that our listeners provided, we can also think about cooling before you exercise so that you can decrease that core body temperature a little bit. Using cooling products during exercise, around the wrists, around the neck, drinking cool water, having that fan blowing on you. And then again, perhaps using those same cooling strategies after you exercise too. And that can help improve your core body temperature more quickly. That can hopefully allow you to resume your activities more quickly than if you were to just allow your temperature to return normally.
We received a couple of comments around goal setting. One came from a retired trainer, physical therapist, who said, the biggest advice that I can offer is not to set goals. He said, I know this sounds counterintuitive, but setting and trying to achieve goals when I'm experiencing an MS flare will set me back for weeks. When I exercise, I only want to do what I can comfortably do. And the second comment comes from someone who's newly diagnosed, who says, I'm really struggling with this change in mindset. I'm very motivated by setting goals and measuring progress, but I recognize that's no longer a wise way to maintain fitness. Do you have any tips to help with this transition? So what are your thoughts around goal setting, and what sort of advice can you share?
Yeah, so goal setting, again, like everything in MS, is very individualized. And some people, as you suggested, John, are very motivated by goals, and others are comfortable with doing what they can do on any given day. I think it's key to say that expectations may have to shift a little bit and may have to be more flexible. People need to be aware of that spectrum, what realistic goals might be. If someone's experiencing an exacerbation and in the middle of an exacerbation, that's probably not the optimal time to be setting goals. So give yourself grace, give yourself opportunity to set goals at a time that's realistic and that is achievable for you. At Can Do MS, we talk a lot about what we call SMART goals. And SMART goals just stand for goals that are specific, measurable, attainable, realistic, and timely. So we want people to say, hey, I'm not just going to start exercising, or I'm going to start stretching every day. We want people to say, be very specific. And we want them to set goals in a way that they can achieve them and be successful with them. So rather than saying, I'm going to stretch every day, someone could say, I'm going to participate in an online yoga class for 10 minutes, 3 days a week for 2 months. And that gives very specific, concrete goals and allows people to work within what's achievable for them.
Well, thank you. Kathy, a couple of questions I'd like to direct your way. Sue Ellen is asking about the stay-at-home orders being lifted and when people in high-risk groups should be comfortable leaving their homes. She writes, besides discussing this with my doctor, are there any general ideas emerging? Are we talking until the vaccine comes out in the spring of 2021 before people in these high-risk categories can actually participate in large groups?
That's a great question. And I think that it's a worry for a lot of people. And I think maybe the first thing to tackle is MS. And is MS a high-risk group? And the answer is no. MS does not increase your risk of getting COVID-19 or the course of infection. There has been no indication of that. Having said that, there are people who are at higher risk. And those are people over the age of 65, those who are either former or current smokers, those with heart or lung conditions, chronic conditions, particularly those that aren't being managed very successfully, people with diabetes, people who have an immunocompromising condition. MS does not make you immunocompromised or immunosuppressed, but there are conditions that can, and those people might be at higher risk. Also, people who are what we call morbidly obese. And if people know anything about BMI, my BMI, which is a measure of your overall body mass, mine is about 23. And what they're talking about with risk factors is a BMI over 40. And so that you could kind of imagine would be a much larger person. But it's those people with that level of obesity that are really at risk here. And so as we emerge from our stay-at-home orders and we open up businesses and our economy, people who are at risk need to be very careful. Everyone does, honestly. But those who have these risk factors need to be extra special careful, because the virus hasn't gone away. The virus is there. And the reason that we had these stay-at-home measures was to do something that we've all heard, which is flatten the curve. And really what that means is to reduce the number of people who are infected at any given time, to ensure that the healthcare system can meet the needs of those who need service, right? So if too many people flood the healthcare system, and we saw that happen in New York, unfortunately, it really stresses the system to be able to provide high-level care. So that was the whole purpose. So lifting these restrictions doesn't mean the virus has gone away, but it does mean that we still need to be careful. Hopefully we'll have a vaccine in 2021, and that will certainly be helpful to everyone. We also hope that there are effective treatments that are identified that will also be helpful as we move forward.
Well, thank you. Jim would like to know if his dog Pedro can catch the coronavirus.
Oh, thanks, Jim. That's a really terrific question. And in fact, I think there was another question similar to that I saw in the question box not long ago from Sandra rather. As it turns out, the American Kennel Club has actually put information on their website, which is akc.org, and you can actually find this. But in brief, domestic animals can get this SARS-CoV-2 virus, which is the virus that causes COVID-19. And less so in dogs, and actually very, very infrequently in dogs. It can occur still very infrequently in cats or ferrets, and also big cats who are in captivity. And those who have been identified thus far have either had no symptoms, and they were identified through a research study, or they had mild respiratory symptoms. And fortunately, all who have been identified have recovered or are recovering. But it is important to know, and some people might be worried then, well, gosh, if my cat or ferret or any other animal has this virus, can I get it back from them, or can it spread to a human? And both the WHO and the CDC are issuing statements that say no, they have not identified it coming from a domestic animal back to humans. So I think that's also pretty important information. But I think
Really?
Pedro's okay.
Good. I'm sure Pedro will be happy to hear that.
Absolutely.
Teresa asks, are MS patients who are currently taking immune modifying medications and who wear any mask other than the N95 mask providing themselves with the best protection to avoid contracting COVID-19?
Wow. So thanks, Teresa. There's a few things in that question that I think we should address. And the first is about disease-modifying therapies and risk. And I mentioned earlier that, in all honesty, we just don't know the risk, if any, of being on a disease-modifying therapy and getting COVID-19, or the course of the infection if you would happen to contract it. It's just simply not known. There are those who believe that there may be a low level or an intermediate level of risk with some of the treatments that deplete certain types of immune system cells. But even in that case, that's not known with 100% certainty. Some guidance, though, does caution and at least being aware that there may be a little increased risk. But now let's talk about masks. So as it turns out, masks aren't so protective for the person. Like if I'm wearing a mask, that's not necessarily protecting me. If I wear a mask, it's protecting you. And that's because I may have this darn virus and not know it. And in my, what we call droplets that come from my respiratory tract, even when I speak, they actually come out of my mouth and travel, and they aerosolize into very small particles. There's been a couple of studies, and there's even some video on the internet that actually shows how far these particles can go when you speak, when you cough, when you sneeze. And when you wear that mask, even that cloth mask that you make at home, it cuts down on that droplet expression significantly. So what you're doing when you wear a mask is you're protecting others. And when everybody wears a facial covering when they're out, then we reduce the transmission of this virus from person to person, and that's critical. Third point, N95 masks. Boy, they're important for healthcare workers. But here's the trick. You actually need to be fit tested to wear one properly. Meaning, if you go out and have one and you wear it and it doesn't fit, you might as well not have a mask on at all. And it's not helping you. These really should be reserved for our healthcare workers and first responders. These are the people that must have them, and there haven't been enough of them for these healthcare workers to use. What we need to use are the cloth masks that we can make ourselves. You can purchase them. There are people making them. You can buy them if you want something that's somewhat designer. You can actually go on Etsy and purchase a mask. But those are the masks that we wear to really reduce the transmission of this virus.
Well, thank you so much. For so much of the information you provided during the webinar, I think that information is incredibly helpful. But I know there are also some excellent resources available when we're not having a webinar in process that people can go to anytime and get good, credible information. Perhaps you can share some of those resources with us.
Absolutely, I'm happy to. So the National MS Society is really an excellent resource about all things COVID-19. We are trying very hard to update our information as new evidence, new data, new ideas, new things emerge. We are also linking people to the CDC, where people can also find excellent information about the virus and also the things that we can do to protect ourselves and others from this virus. If people have questions, I highly suggest they contact an MS Navigator. This is truly an incredible service of the National MS Society. These navigators are highly educated and highly skilled in fielding the questions that people have and identifying the resources and support that people need. You can access an MS Navigator by going on our website. You can access by calling or emailing. And I think on the slide, let's see here, I'm not quite sure I'm seeing it on the slide, but I believe maybe on the next slide, it'll actually, oh, there it is, look at that. There's a phone number and also the email that people can use to contact an MS Navigator. And here's the thing, if you're not sure if it's a question for an MS Navigator, doesn't matter. Go ahead and contact that person, and I'm going to tell you they're going to give you the information that you need or refer you to the information that will help you. You can also contact us through lots of different avenues and connect with us via social media on Facebook, Instagram, Twitter. We already mentioned, I believe Mandy mentioned, that our exercise videos are on our YouTube channel, and you'll also find recordings of our webinars there as well. So these are all avenues for people to connect with the information, the resources, and the support that they need. You can go back really quickly to that previous slide. I'd just like to mention Real Talk MS, because that is a fabulous podcast by none other than John Strum. And I'm going to tell you, there's some fabulous information there. Whether you're listening to the most recent or you want to go back and listen to those that have been previously produced, they are enormously helpful. Can Do MS is an important partner of the National MS Society. This is an organization that empowers people to live the best life that they can. through taking charge of certain things in their life that they can take charge of to make it easier to deal with MS and to improve quality of life. Also, I've mentioned the CDC, but I have to tell you, they are providing very credible information about this virus, what we know about it, and what we can do about it. So I definitely suggest that people go there. Join our Facebook group. This is a new group, but it's another way to connect and be in touch with others and get that support that you need.
Well, I want to thank Kathy Costello and Mandy Rohrig for sharing their knowledge and insights with us today. I'd like to thank everyone who's joined us for your great questions. Please remember that a recording of this webinar is going to be available for your review on the Society's website. And now I have a quick favor to ask you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. Completing the survey makes a difference. The information you provide helps us continuously improve, and it helps shape future webinars. The survey takes just 1 minute and makes a real difference, so please take a minute and fill it out. On behalf of Kathy Costello, Mandy Rohrig, and the National MS Society, I want to say thank you once again for joining us. Please stay safe and make healthy choices.